ADHD is a common childhood behavior problem. It can be hard to diagnose and even harder to understand. On this video, I'm going to talk about attention deficit hyperactivity disorder, popularly known as ADHD. Hi guys, welcome back to my channel. I'm Kudite, the therapist for children with special needs. So if this is your first time coming across my channel, you are welcome. Please kindly subscribe and don't forget to turn on your notification bell. And please also share so that the information I'm dishing out also reach those people that need them the most. You can hear ADHD being discussed everywhere these days, on the radio and TV, even in books. The moment a child seems restless or bouncing, some parents and teachers immediately think, oh, hyperactivity. But certainly not every busy, curious child has ADHD. How do you tell the difference between an active, challenging, or nothing but not mean child versus one with a diagnosable disruptive behavior disorder such as ADHD? To a great extent, it is a matter of degree. In other words, how frequent and how impairing are the problems? Are there other possible causes of the behavior, such as an abusive or chaotic environment? ADHD is a behavior pattern with core deficits in two major areas: impulse control and focusing on tasks. It is one of the most common psychological conditions affecting children. Between 3 to 8% of school-age children are estimated to have ADHD. Most often, ADHD is diagnosed between the ages of 4 and 10 and appears about 3 times as often in boys. Children with the most common form of ADHD are repeatedly inattentive, impulsive, and hyperactive. They will blunt out answers, interrupt others, and won't wait their turn. Because of problems with following rules and explosive energy, children with ADHD often get into trouble with parents, teachers, and other kids. By adolescence, the hyperactivities often subsides into more subtle signs of fidgeting and restlessness, but problems with attention, concentration, and impulsivity usually continues into adulthood. Although ADHD is a common childhood behavior problem, it can be hard to diagnose and even harder to understand. Teens who have ADHD often end up with other problems such as depression, anxiety, or poor school performance. They may also be at greater risk for smoking and using drugs, especially if ADHD is not treated. On the other hand, most adults who have had ADHD as children lead successful lives.